Hi, my name is Desiree Casas, and I will be performing the vital sign skills video today. I'm going to go ahead and start off with ensuring that I have all of my items. So I do have my blood pressure cuff, I have my stethoscope, and I do have my watch as well. Okay. So I will go ahead and perform hand hygiene as I am walking into the patient's room. And I will close the door and or curtain to ensure patient's privacy, and I will make sure to introduce myself to my patient. Hi, miss. My name is Desiree, and I will be your nurse today. Okay. And if I can have you please identify yourself with your first and last name and date of birth, please.
Elena Casas 1406.
Perfect. So I did go ahead and ensure that I had the correct patient with two patient identifiers. And is it okay if I go ahead and take a set of vital signs on you today?
Yes.
Perfect. So I'm going to go ahead and start off with patient's radial pulse. I'm going to go ahead and locate that. Okay, so I did go ahead and locate patient's radial pulse on initial palpation. It looks like she does have a regular rate and rhythm. So I did go ahead and get patient's pulse. Patient did have a pulse rate of 32 for 30 seconds. So multiply that by 2, we will go ahead and get a number of 64, which does fall within the adult range of 60 to 100 beats per minute for an adult patient. I did also go ahead and observe patient's respirations. Patient had 9 breaths within 30 seconds. So if we do go ahead and multiply that by 2, we'll get 18, and that does fall within the adult normal range of 12 to 20 breaths per minute. I'm going to go ahead and just feel right here. So did go ahead and palpate patient's respirations. Patient does have normal depth. She has equal chest rise and quality with good tidal volume on observation, right? And I'm going to go ahead and start by taking your blood pressure, okay? So I'm going to go ahead and feel for patient's brachial artery. So I did go ahead and locate that. I'm going to make sure that I do select the right cup, which we do have here for patient. And there are arrows right here, which I will make sure to line up with patient's artery to get the correct blood pressure. All right, I'll go ahead and have it right there. And then if I can just have you hold this right here, please. Okay. And then do you know your blood pressure by chance?
120 over 80.
Okay, perfect. So I'm going to go ahead and take that initial 120 as a base, and we're going to go ahead and add 30 millimeters of mercury to that. So we'll use that as an indicator. And then once we do that, and once I pump up, we'll make sure to go ahead and release 2 to 3 millimeters of mercury per second to obtain the right blood pressure. And if I can just have it right here, please. Thank you. Okay. And then as I'm taking the blood pressure, I will go ahead and ensure that my tubing does not touch just to make sure to get the right sounds. Okay. And I'll go ahead and pump it up to 150. And then as I release, we'll make sure to go ahead and initiate, listen to the initial Korokov sound, and then we'll go ahead and listen to the 5. There possibly may not be another after that, but I will make sure to listen for 10 to 20 millimeters afterwards, just to make sure I get the right diastolic pressure. Okay, so upon taking patient's blood pressure, I did go ahead and receive a systolic pressure of 112, which does fall within the normal range of 100 to 120 beats per, 100 to 120. And then I did go ahead and get her diastolic, which was 62, and that does fall between the range of 60 to 80. So I'll make sure to document those findings. All right, Ms. Casas, was there anything else that I can assist you with today? Any questions, comments, or concerns?
No.
Okay, perfect. So I will go ahead and perform hand hygiene, and as I will exit the patient's room just to document my findings.